What am I having for dinner tonight? It's a good question. I don't know. Hello, my name's Tim Toe. I'm the head of unit for the Southern Adelaide Palliative Service, which is a specialist palliative care service based at Flinders Medical Centre, supported by Laurel Palliative Care Foundation as part of the Hospital Research Foundation group.
Can you define palliative care?
That's a really good question because I think there's a lot of confusion about the term palliative care. Some people talk about palliative care if it's the care of someone at the end of life. Now, that could be days, weeks, months, and even sometimes years. It's an approach that really focuses much more on quality rather than quantity of life. Palliative care can be delivered by all sorts of clinicians, not just specialist palliative care clinicians.
Tim, what is the difference between hospice and palliative care?
I think these terms are also confusing at times, but hospice is really referring to that building where we care for patients at the end of life. That's distinct from our palliative care service, which actually cares for patients in where the patient is, their home, in a nursing home, in hospitals, or in our hospice.
Does palliative care mean death is imminent?
So that's a really interesting question. Clearly, palliative care means that you are approaching the end of your life, but actually palliative care in itself does nothing to seek to hasten death or speed up death. Actually, the treatment choices that we make with them and on behalf of them actually just needs to reflect where they are in their illness and their treatment preferences.
Is palliative care primarily pain management?
Actually, palliative care is much more than about pain management. It's much more about the whole person, their family and other important relationships, their environment, their supports, what other services are in place. We think about their physical needs, their mental health needs, as well as other things like spiritual and cultural issues that might be relevant for them as well.
Can you ever leave palliative care, or is it a one-way thing?
There's lots of different reasons why people get discharged from a palliative care service. For some people, it's just because the referral wasn't appropriate. For other people, it can be because it was expected that they were going to deteriorate quite quickly, but that's actually turned out to not be the case and they stabilise. For some people, they're referred to deal with a particular issue and that's been, dealt with and there aren't any particular needs at that point.
Is palliative care just for people with cancer?
Traditionally, you're right, palliative care has dealt with a lot of cancer issues. And even to today, about 70 to 80% of our work is predominantly cancer. If you have crippling heart failure or lung failure or motor neuron disease, palliative care services are commonly dealing with those sorts of diagnoses.